Greetings, my name is Jude O Domingo, and today I will be performing the procedure for assessing the face and the skull. And then, of course, we will be providing the rationale at the end. So let us proceed. Now, the first procedure in all of the procedures we will be doing is, of course, to introduce ourselves to the client and then verifying the client's identity, and then explaining the procedure to them, why is it necessary, and how they can cooperate. Now, the second step would be for us to perform hand hygiene and other infection control procedures. Now, the third step is for us to provide client privacy. The fourth step is for us to inquire about the client's past health history, if they have any problems with the skin, such as any lumps or bumps, itching, scaling, or dandruff, or if they have any problems with the memory, such as loss of consciousness, dizziness, seizures, headaches, facial pain, or any facial injury. Now, if the client does have this, we have to assess or inquire again when and how these problems occurred, and then how long has this problem been occurring, and then also if they have any doubts or if they have any intuition on how these problems occurred or what caused the problem, and also if they have any symptoms, medications, or if this problem have been recurring several times. Now, the fifth step would be for us to inspect the skull for size, shape, and symmetry. Now, the sixth step would be for us to inspect facial features. Now, the seventh step for us would be to inspect the eyes for edema and hollowness. Now, the eighth step would be for us to inspect or note the client's facial symmetry of movements. Now, this includes, or for us, we are going to be asking our clients to raise or elevate the eyebrows, to frown or to lower the eyebrows, for us to ask the client to puff the cheeks, like that, puff the cheeks. And then we're also going to ask the client to slightly close their eyes, not touching them, of course. And then we're also going to be asking the client to smile, and then to show teeth. Now let's proceed to the rationales. The first step is, of course, introduce yourself and verifying and explaining to the client. Now, we have to introduce ourselves to the client so that we can build trust. Verifying the client's identity will prevent us from malpracticing or performing the procedure to a different client. That could lead to, like what I said, malpractice. Now, the second step, the rationale for the second step, which is performing hand hygiene and other infection control procedures, is so that we can actually prevent cross-contamination between the client and us. Because we also have harmful microorganisms in our hands, so we have to do this. And one way or two ways that we can actually prevent cross-contamination is for us to wash our hands and also for us to wear gloves. But of course, we have to wash our hands first, then wear the gloves, okay? And then, yes, the third step is for us to provide client privacy. Now, there are some clients who don't like other people knowing their medical conditions, so this is something that we have to consider. They trust us, so we have to give them the privacy that they need. Now, the fourth step is, of course, inquiring about the client's past health history. We have to do this for most of the procedures now, mainly because there are some clients who have experienced this in the past. And now doing this, or at least inquiring about their past health history, will allow us to have a baseline data on what they know about this, what they know about their condition and what type of procedures have been done to them, so that we can reference this just in case, or we can reference this to their current health history. Now, inspecting the facial symmetry or the facial size and symmetry, some clients have a very asymmetric face, some have a thicker or larger skull than others. It is a medical condition sometimes. And then also, yeah, like the size is a bit bigger, like maybe sometimes encephalitis and such. And then, of course, inspecting the facial features. The facial features that I can think of is maybe the cheekbones. Usually some clients have a very defined cheekbones. Sometimes it's hereditary or according to their bone structure, sometimes it's their health. And in regards to health, I can think of people who eat less. Usually to those people who don't eat too much or who don't eat well, they have well-defined or um, they have very defined cheeks, or they have very defined bone structure because there's no fats or any fluids that's actually circulating in their body. And then also we can also inspect sometimes the jaw, if it's actually crooked, or yeah, crooked jaw, and also the symmetry of the ears, and then the placement of the eyes, and then the nose. We can inspect those for symmetry as well. And then of course the eighth step, or the seventh step, is for us to inspect the eyes for edema and hollowness. I can't think of anything for edema, but an example I can give for hollowness is that a client actually stayed up a little bit all night, or became an all-nighter, just slept in the morning, or is sleep deprived. Usually their eyes are very sunken because the eyes did not rest, and usually that affects the nerves for the eyes. Now the ninth step is of course for us, or I mean the eighth step. The eighth step is for us to assess the client's facial symmetry of movements, or the movement symmetry within their face. Now an example for this is that, now the reason why we have to do this is that we have to assure that both sides of the face are actually moving, because sometimes we have clients who maybe sometimes experience any heart-related disease. Let me think. Hypertension. One of them is hypertension or high blood, or maybe heat stroke. Sometimes even heat stroke. My relative have experienced heat stroke, and half of his face is paralyzed, or half of his body is paralyzed, and then he cannot move this side, and you only can use this side of the face. Now the thing is, we have to examine this so that we know that both sides of the face are moving. And the example a while ago is if we can puff the cheeks. As you can see, we can puff it, or puff it on one side, or puff it on the other side. We can do that, or we have to raise the eyebrows, raise or lower, or the eyes. I cannot lower my eyes. And then also to smile, or to show your teeth. We can see that both of these two are actually moving, so that's okay. And then of course the ninth step is for us to document the client's findings, or to document the findings to the client's chart or the client's record. We have to do this so that we again have an updated baseline data for our client, and so that we would be able to make a proper healthcare plan for the client for her to follow. And this is something that we can compare to whenever the procedure or the healthcare plan is in action, so that we can adjust and then modify, and then we have to constantly document so that we would be able to be updated with the client's health status. Now again, thank you very much. My name is Jude O Domingo, and this is the health assessment for assessing the skull and the face. Thank you.